You're listening to a Raconteur Studios podcast.
Hello and welcome to the After Hours Skin Clinic. I'm consultant dermatologist Dr. Emma Craythorne, and this is the place where I answer all of your skin related questions. These are the kind of questions that I get asked outside my clinic everywhere I go, whether it's in the park or the playground or having a glass of wine with my girlfriends. I'm joined by the fabulous Dr. Ellie Rashid with the most fabulous hair, which is why she's helping with the hair episode.
Yeah, exactly. You can only come on with fabulous hair.
And you do have fabulous hair, although it's looking a bit shorter. Did you get
I've had it cut, yeah.
What did your mum think of that?
She's upset. She's like, why have you cut your hair short? It's like, keep it healthy.
Keep it healthy. So we do have lots of questions that came in because I did the episode with Ruth, my hairdresser, where she cut my fringe. And lots of questions came in. So shall we go through them?
Let's go through them.
Okay, so the first question that came in is 2-in-1 products for the hair, yay or nay?
So I think they're really convenient. And if you're someone who just wants to cut some time and you can't really be bothered, then yeah, for sure, convenience. But I prefer a separate cleansing shampoo and then a separate conditioning treatment, because also I focus my conditioner on the ends of my hair, not on my scalp. And then I focus my shampoo on my scalp and not so much on the ends of my hair.
I'm exactly the same, because the part of using the shampoo really is to get the excess oils off your scalp, so it's not gathering there. But you don't really want to get the excess oils off the bottom of your hair in a way, because you want to try and stop that from looking so frazzly.
Yeah.
And then by the time you put conditioner on, you don't really want to be putting the extra oils back on the top of the head. You want them all to go at the bottom of your hair. So I would be like you. I'm quite happy to take that extra moment to put the conditioner on after.
Yeah, same.
And I think it is probably better for your hair.
Yeah, it works better.
And better for your scalp.
Yes. Yeah, for sure.
But it is convenient.
It's so convenient.
So is it a yay or a nay? Well, it's probably a no from me, but it's okay if you want to.
Yeah, exactly. Not the worst thing in the world to do.
Question 2, salicylic acid or urea in hair care products?
So I like an exfoliating agent in shampoo products. I think they can work really well. Exactly as you say, they can cleanse the scalp, lift that scale, lift that debris, lift the oils. So I think it can work really well. Yeah, good.
I think the only people to be a bit careful of, if you're somebody who has a fairly sensitive or very dry scalp as it is, and you don't have additional scale that's not kind of needing to be removed. So they're the only people I would say not to put the salicylic acid into.
Yeah, they're normally marketed though for people that have like scaly build up on the scalp rather than sort of not having scaly build up.
It's sometimes hard, I think, for people to know, do I have dry skin because I've got dandruff, or is that oily skin? I think I get a lot of people confused. Most cases, dandruff is because your scalp is oily, not because it's dry.
Yeah, and there's like moisture retention, and there's a growth of the colonies that live on the surface of the scalp can change. The microbiome changes. You get an uptick in this yeast that lives on the surface of the scalp. And so, yeah, generally it's normally people that have an oily scalp that often will get problems with the scale that develops on there.
And usually they have oiliness elsewhere. So maybe more blackheads in your ears, for example, or on your nose, or a scale that might affect around your eyebrows or the sides of the nose. We think of this something called the seborrheic dermatitis, and that often goes hand in hand with dandruff, and sometimes acne can go hand in hand with dandruff. Whereas usually if you've got a condition like eczema, or you know you have very dry skin elsewhere, then that is whenever, if you see scale on your scalp, it's usually related to a dryness. What do you think about fragrance in hair care products?
Love.
Yeah.
I love the experience.
I love the experience
I'll
as
use
well.
the shampoo because of the smell. I love the smell of... You know, do you use hair perfumes?
I used to use hair perfumes. I don't really use hair perfumes because I think it clashes with my perfume that I actually like to wear as my perfume. But I will just put my perfume in my hair.
Yeah. I mean, so do I.
What's the difference?
I don't know, but I don't know, actually. I've noticed that some friends have, by radio, they do like a specific hair perfume, and people will buy that and put it in their hair. But I love lovely smelling hair products.
I'll tell you what I hate and I think should not be allowed,
What?
is in scalp oils for men who have a bald scalp. Often you can get nice fragranced oils that go on to the scalp, and it's done as a kind of like a scalp treatment. And I absolutely hate fragrance in these because what can often happen, particularly in the summer months, is that some of the fragrances, which are often essential oil based,
I
can
react to the
pick up
UV.
the UV. And I have seen countless men with bald heads ending up with a melasma like pattern across their scalp. It's the same kind of pattern that some people get on their neck whenever they spray a fragrance on their neck and then it reacts with ultraviolet radiation. It looks like a browny, slightly red, almost like webbing kind of pattern to it. And the same thing can happen on a scalp with these fragrant scalp oils. So I am very against those kind of
I
oils,
love how
especially in the
fixed
summer.
we are with like, those people cannot have fragrance. We, however, can.
Well, they can have fragrance, just not on the top of their bald head. Vinegar rinses.
No.
Why?
Oh, just the smell.
Well, the smell is bad. Have you tried it, But
No.
I have.
I don't like the smell of vinegar with food.
Well, I actually
can't
did
bear
it.
the smell.
I've been at a photo shoot for something, and the hairstylist on the day said, "Oh, you've got a lot of product buildup in your hair. You need to do a rinse of it. And the best way to do that is to just get some cheap vinegar, put it in your hair, wrap it all up, and just leave it for a couple of hours and then rinse it." And so I called my 2 teenage girls and said, "Oh, hey, this is what we'll do. And the house is going to be so smelly. We will do it and we'll have fish and chips at the same time." Because then it will be not so bad.
Mask the smell. But did that person know that you're a consultant dermatologist?
Yeah, it was a
Oh,
shoot
fine,
for
fine.
a
Oh, right.
skin thing. And I did look it up because I didn't just take his word for it. I did deep dive into
well,
it
it
to
just
see.
exfoliates, doesn't it? Exfoliates the debris off the
It
surface. of the
does,
scalp,
yeah. So it does take away the build-up that's been there. But it was so smelly and it smelled for a long time actually afterwards. So I'm not sure that it is the most sophisticated way of removing the dead
Cheap and
build-up.
cheerful, though.
Very cheap and
And you
cheerful.
probably got it in your house.
And I got fish and chips.
Win.
So there's an interesting question here about does Nizoral help hair growth? But it's really about the drug that's in Nizoral called ketoconazole. And there is some evidence, isn't there?
Yeah, so there is some evidence to suggest that it can impact on dihydrotestosterone levels and its impact on the hair follicle. So it can be helpful for conditions like androgenetic alopecia, or male or female pattern hair loss.
And they did show in mice studies way back in 2005 that it made more of the hair stay in that active growing phase. So, and I think that even if you get the inflammatory component of a seborrheic dermatitis, which causes dandruff, under control, then that's going to lead to better follicle health anyway.
Yeah, I use Nizoral shampoo.
How often do you use it?
So if I'm really struggling, my hair's really itchy, then I'll use it like every time I wash my hair, so every other day for 1 or 2 weeks. And then my maintenance is usually once every 2 weeks.
Okay, and you use it by applying it directly to the scalp,
Directly
not
onto
watching
the
the
scalp.
shaft with it.
Directly onto that. Well, it's really drying
Yeah.
actually for your hair. So you really don't want to get it on your hair shaft. You want to get it directly onto the scalp because that's where it's going to have its benefit. And then I do leave it on for between 3 and 5 minutes. Just do something else and then wash it off.
There's a question here about hair thinning after thyroid gland removal, and that's probably related to the thyroid hormones being out of balance, which can be that they're either too high or too low, and thyroid hormones affect how the hair grows. So there's a number of reasons why this might happen, isn't there?
Yeah, so really you want to just look at your thyroid function test. So that's a blood test. And then you normally have an adjustment of your dose of thyroxine so that you can be in that perfect range for optimal hair growth.
Yeah, and sometimes even the shock if somebody has been in a period where their thyroid hormone has been out of kilter, whether that's been too high or too low, and then it becomes stabilized, it can take a long while for the hair itself to actually catch up and be regulated to grow in quite the same way. And sometimes that difference in your thyroid hormone can have such an impact on your body itself that another condition that's totally different in a way to hair loss as a result of the thyroid gland itself is something called telogen effluvium, where if your body has had some big shock from an illness, then actually you can lose hair several months later as a consequence of that. And I've seen that once in a patient. Yes, they had their hair thinning because of their thyroid gland being out of kilter. But then subsequent to that, after the thyroid gland had been removed, it was quite a big operation for her. She was unwell afterwards. She then had a telogen effluvium as well, which is where you lose a whole lot of hair all at once. And we've had so many questions about androgenic alopecia that I don't think that we can really cover it here. So let's do it in a full other episode.
Yeah, good idea.
And alopecia really is just a blanket term for loss of hair. But there's lots of different types, isn't there? There's a type that relates to scarring of the hair follicle. And then there's another type that relates to not scarring, but actually the inflammation causes the hair to be lost and the hair can actually essentially recover. So how do you break those down?
Yeah, so when people hear the word alopecia, they just think of the autoimmune alopecia areata. But exactly as you say, scarring and non-scarring is how I normally divide it up. And then in the non-scarring form of alopecia, that's where alopecia areata sits. So that autoimmune condition where your immune system wraps itself around the hair follicle and doesn't allow the hair to grow through. So there's no actual scarring or issue with the hair follicle itself. So once the immune system has sort of backed off from the hair follicle, that hair can regrow as normal, or once you've been started on treatment, then that hair can grow as normal. But then we've got the scarring types of alopecia, and those are a little bit more tricky. So the quicker we institute treatment for those scarring types of alopecia, so these things are like lichen planopilaris or something called frontal fibrosing alopecia, and certain other sort of inflammatory conditions that can leave scarring on the scalp, the quicker we treat them, the less the risk of that scarring developing and the more chance there is for the hairs to grow through around the areas that have scarred.
Yeah, there's actually a question that's come in. It says, what is the best treatment for frontal fibrosing alopecia? That question was on the list as well.
Yeah, frontal fibrosing alopecia is a relatively rare type of alopecia. It's the scarring form of alopecia that we see, and it normally affects the frontal hairline. You normally get full recession of that fronting hairline. You can see almost like this white, shiny, scarred band of like where the hair follicles used to be, and it can go up around the temples and around the temples, and it can be really debilitating for people and really upsetting for them because the chance of growing hair back in those areas that have been affected is really quite minimal. But we can definitely slow the progression down, and with good treatment we can try and help improve things.
I know you said it's rare. It's not rare in my clinics at all. I see it quite commonly, and I think it's probably something to do with the fact that I see so many people with photo damage, and probably photo damage will be playing a role in this as well. You're right. You see that white shiny band as the hairline goes back. But the key thing is if you look around the base of those hair follicles, you see a slightly raised, slightly red with a tiny little bit of scale around the hair follicle where the inflammation is. And they're the hair follicles that you can kind of save if you get treatment in really, really quickly. So even very first line of putting on a very potent topical steroid, if it's going to take time to see an actual dermatologist, if your GP is able to prescribe you a very potent topical steroid, that can often be enough to get it under control. Well, that's a wrap for this mini episode of Listener Questions. And a big thank you to everyone who sent in the questions. And thank you, Ellie, as always, for being here with your fabulous hair to answer them. If you have a question that you want us to answer, then please send it over. Send 5 over. We want to address the issues that mean the most to you. Details of how to get in touch are all in the show notes. So if you know someone who'd find this episode useful, then please share it with them. And don't forget to give us a follow. Okay, it's bye for now. Thank you, my lovely listener, for joining us today. Take care of yourself and your skin. And don't forget your SPF. And see you next time on the After Our Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.